Avascular necrosis, also known as osteonecrosis, is the death of bone tissue due to lack of blood supply, or ischemia. It can lead to tiny breaks in the bone and cause the bone to collapse. This process can take months to a year to develop. Symptoms may include joint pain in the affected areas. Osteonecrosis typically affects the epiphysis of long bones at weight-bearing joints such as the femoral head, knee, talus, and humeral head. The most commonly affected area, however, is the hip. The carpus and the jaw are the other less commonly affected areas. Osteonecrosis occurs when part of the bone does not get enough blood flow and dies. It can be caused by severe trauma, such as a fracture or dislocation that affects blood supply to the bone. The idiopathic causes are using oral or intravenous steroids, excessive alcohol use, sickle cell disease, or any blood disease that causes abnormal blood clotting, dislocations or fractures around a joint, clotting disorders, HIV or HIV drugs, radiation therapy or chemotherapy, Gaucher disease, systematic lupus erythematosus, leg-calf Perthes disease, and decompression from extensive sea diving. Avascular necrosis occurs when blood flow to a bone is interrupted or reduced, which can be caused by joint or bone trauma, like hip dislocations, fatty deposits in the blood vessels, and certain diseases. Sometimes the cause of avascular necrosis is not brought on by trauma and is not fully understood. Treatment of this disease includes non-operative treatment, which includes aldronate-only therapy and bisphosphonates, total hip arthroplasty, which is a surgical procedure in which the surgeon removes the diseased part of the hip joint and replaces them with new artificial parts, rotational osteotomy, which attains femoral head coverage by cutting 1 to 3 of the pelvic bones, which the activulum being rotated on the innate structures. Pain medications and modifying activity to reduce weight bearing on affected joints is usually the course of treatment in less severe cases. Some studies show that short-term biphosphonate treatment may slow, improve, or prevent bone collapse in the hip or the knee. To prevent osteonecrosis, limit alcohol, keep cholesterol levels low, monitor steroid use, and do not smoke. 2 interesting things that I learned. Osteonecrosis near a joint can cause arthritis in that joint, and people of any age can get osteonecrosis, but it is most common in individuals between age 30 and 40.